Everybody, it's Kyle, and then Caitlin will be doing another recording, but we're both going to be talking about amputations and how they affect, everyday lifestyle. So, like a basic information on like what an amputation is it's a surgical removal of either a small part or a big part of the body. Usually, it's limbs or extremities, and a lot of these amputations are used as procedures to either stop disease or to lessen pain. They're usually there to make people's lives a little bit better. And then another weird thing is in some countries they use amputation as a form of punishment. So if you get caught doing a specific type of crime or anything like that, they'll use that as your punishment. And so, like, a lot of the reasons that people suffer from amputations or have to deal with amputations is because of an accident or they were born with some sort of disability. And so most of them, like I said, come from like a severe injury, whether it be a car accident or burns or things like that. Or if they were born, they have like tumors or like bad infections with just different like nerve tissue and stuff like that. That'll also cause it. People also get quite a bit of amputations from frostbite, from being outside and getting frozen. So most of the amputations that take place here in America, there's about 185,000 of them a year, roughly, and they're usually caused with cardiovascular diseases and trauma are the main causes. Less than 2% actually deal with either cancer or tumors or things like that. So most of these causes of amputations are from diseases like cardiovascular disease or from trauma, like I said, with car accidents and going through that process. Also with amputations, the process of an amputation usually takes quite a bit of time. There's like a before, during, and after that they deal with. The before process is usually more of a game plan. That way they know what to expect. They know the recovery time. They know what's going to be entail, what they're going to have to learn how to do. And then they also meet with the doctors and they talk about where they're going to be getting cut, what's going to be lost, and that whole realm. They also plan for like complications, and so they let the patient know that, hey, if we have this specific complication, you're going to have to deal with this, and this, and then you may end up losing a little bit more than you were expecting, but that is all taken into consideration when getting an amputation. That way they know, hey, sometimes it doesn't go well, and this is what you can expect. During the amputation, it's usually pretty quick. Before they go through and perform an amputation, they are very strict on your pulse, making sure that they don't get rid of unnecessary material. They try to keep as much as they can attached to the body. They also do like a skin temperature test where they identify what is either dead or what is not working or what's not functioning properly, and then they're able to identify what's going to go on from there. And so with a lot of this process of the before, during, and after, the after process usually isn't looked into a whole lot. A lot of these people have to deal with the aftermath of a amputation on their own. And this is where like the depression rates, anxiety rates, and suicidal rates increase because now they've lost a big section or part of their life, and now they have to learn how to cope with it. And so Caitlin's going to talk a little bit more about the TR process and how they were able to start with the issues and how they can go through that entire process and become out better people through going through an amputation.
Okay, hi guys, this is Caitlin, and like Kyle said, I'm going to be talking about the TR process for amputees. So just to kick it off, so starting off with assessment, the TR process in general is going to start as soon as the doctor decides that the patient needs an amputation. So that's when the treatment team is going to be assembled, and everyone's going to get their assignments, and they're going to start assessing and doing all sorts of different kinds of assessments. So just to list a couple of things that we're going to look at and test are cognitive, social, physical, spiritual, psychological, leisure functioning. We're going to just test their abilities and look at any improvements that we can make, their strengths, their interests, their limitations, anything that we can do to help them improve, or anything that we can use to help us improve those things that are weak. So moving on to planning. Planning is going to be really important for this patient, as with all patients, but it's going to be really good for the treatment team to assemble all the information that we gathered from the patient during all the assessments, and the treatment team is going to work with the patient and create some long-term goals, short-term goals, and objectives to help them accomplish everything. They're going to select different modalities and content and like facilitation techniques, and they're going to communicate everything that they did with the clients, of course. And then moving on to implementation. One thing super cool about treating someone with an amputation is that there is not just post injury. With a planned amputation, we're going to have both a pre-op and post-op therapy. So our pre-op is going to focus on strengthening the core and the cardio and upper limbs, so that the patient will be able to use a wheelchair and use crutches, everything after the operation. And post-op, that's when everybody's going to jump in and do their part. So the physical therapist is going to start doing different exercises to help the patient learn how to walk again, of course. And there's going to be a psychologist there to help fight any depression, help teach any coping mechanisms, anything we would need to fight that, because that's really common in amputees. Another thing is the prosthetist is going to come in soon after the amputation, within the first week, and get them fitted for their prosthetic. There's so many people involved in this treatment team. There's going to be a dietitian. There's going to be, along with the prosthetist, the doctors and the surgeons, and of course there's the physical therapists, occupational therapists, and recreational therapists. So we'll all be working together to help the patient recover at least to the max that they can with us at our facility. Then after, we're going to do an evaluation and see how the patients come, and like all evaluations, we're going to have it mirror the assessment, and it's going to be super similar, so we can see the progress that's made, and so that we can have a kind of gauge for what we're looking for, how much more we can improve, different areas that we need to work on more. And then once the patient has been cleared and has improved as much as they are going to with us, then we will talk discharge. And once they're able to, we're going to make follow-up appointments, and we're going to talk care plans for the future. For diabetics, that could mean either medications, that could mean physical exercise regimens, that could be, if they need it, we could get them any equipment they need. So that'll be weird. Wheelchairs, if they want to around the house, we'll make sure they have different types of prosthetics if they want. So though there's a lot of options for aftercare for amputees. But that is the treatment plan